So what are some nutrition changes you can make that can help you with your headaches? Hey, I'm Dr. Aaron Wall with Gateway Chiropractic. I'm excited to kind of help you if you're dealing with this and you want to see some physical change happen. There's a couple of easy steps you can implement right now, and that's what this video is about. So we want to help you out with this. I would say first off, look at your diet. Look at what you're eating on a day-to-day basis. I can personally tell you that with our patients, one of my 4 degrees is nutrition. For our patients that have headaches, there's typically a diet change that we can make that helps them significantly. What we find is people that are on a high carbohydrate, high sugar, or high caffeine type of intake daily, that's going to create a lot more headache responses in people because you can be dehydrated, you're getting a ton of sugar, all those things spike your blood sugar. That can create headaches in the long run. So some simple changes you can make if you're doing a lot of carbs, if you're doing a lot of breads and pastas, a lot of rice, a lot of sugary foods, obviously weaning down that significantly to more of a higher healthy fat, higher protein, very low carb diet. You can do that for about 2 to 3 months, and then you can just go like 0 carb, 0 sugar at that point, make that transition. And for a couple of weeks, you'll have some withdrawal symptoms of headaches because you're not giving your body all the sugar that it's been addicted to, but that'll make a huge difference in the long term. Going along with that diet change, your water intake makes a huge factor when it comes to dehydration. If you didn't notice, most people, especially where we're at in Texas, most people walk around dehydrated. You're just not getting enough hydration, not enough water. And one of the big warning signs that you're dehydrated could be having, headaches. So obviously, increasing your hydration, just healthy sources of water, that's going to help quite a bit too. And then another one would be like caffeine intake. That's a big one. So many people are addicted to coffee, addicted to the caffeine, the energy drinks, what have you. That is something that can really cause some problems long term, not just with your blood sugar and your heart racing, but also with headaches. So reducing caffeine, it's kind of like reducing sugar. For a couple of weeks, you'll have some rebound headaches from just getting off the caffeine, but you'll find that after a couple of weeks, that'll settle down and you'll feel a whole lot better. A couple nutrient supplements that I think would be very helpful if you're dealing with headaches as well. One of them is magnesium. It's just a staple. It's an electrolyte, it's a mineral. It's something that a lot of people are very deficient in. But magnesium is something that relaxes muscles. It helps dilate arteries, so you get a little bit more circulation from taking magnesium. I suggest taking at least 300 to 400 milligrams per night. I think taking it at night is the best approach too. While you're sleeping, you can kind of utilize it better. But magnesium is awesome if you're dealing with headaches as well. In addition to that, or one of the last ones I want to talk about, is omega-3 fatty acids. About 1,500 milligrams of omega-3 fats, a healthy source, is clinical studies show that it does a really good job at reducing frequency and duration of headaches, because a lot of times when you're deficient in healthy fat, like we talked about diet, it can create a pattern where you're starting to develop headaches. So getting that healthy fat in through supplementation helps so much. So those 5 tips I think will really help you if you're wondering what things can you do lifestyle wise to help you with your headaches. But these things are also not things that actually can change structure. So if you have never had your neck looked at, if you've never had your spine looked at and you have headaches, obviously make sure that is a priority. That's huge. And in addition to doing that, obviously some nutrition changes, man, it'll be a game changer for you. So hopefully that helps you out, and we'll see you in the next video.